Ever get those like earaches that just won't go away?
Oh,
You
yeah.
know, they kind of make you wonder if something a little more serious is happening.
Right.
Well, today we're doing a deep dive into a condition called mastoiditis.
Okay.
It's a bacterial infection of the mastoid bone, which sits right behind your ear.
Yeah.
And you're going to want to pay attention to this one, especially if you're prone to ear infections or maybe have a weakened immune system.
Yeah, that's right. We're going to unpack kind of why those ear infections can actually be a bigger deal than you think.
Right.
And even explore a surprising alternative treatment that was mentioned in the source material.
Okay.
But first, let's just break down what mastoiditis actually is.
Okay, so mastoiditis,
Yeah.
it's an infection, but where exactly?
So the mastoid bone itself is actually filled with these tiny little air cells, almost like a honeycomb.
Okay.
And if an infection in your middle ear isn't treated, it can spread into those cells, causing inflammation and a whole bunch of problems.
Wow.
Imagine like a sponge soaking up dirty water. That's kind of what's happening in your mastoid bone.
So it's not just an ear infection anymore. It's like it's seeped into the bone itself.
Yeah.
Ugh, that's making me cringe a little.
Yeah, it's definitely not something that you want to ignore.
Right.
And the tricky part is that the symptoms can be all over the map.
Oh, really?
Yeah, some people just have like mild discomfort,
Mm-hmm.
while others might experience really serious pain and swelling behind the ear.
Our source material also mentions some symptoms that I wouldn't have expected,
Oh, yeah, like what?
like the ear feeling full or even like sticking outwards.
Yeah.
Who knew an ear infection could do that?
It's a good reminder to really pay attention to any changes that you notice,
Right.
especially if you've had a recent ear infection.
Right.
Things like that, might be your body trying to tell you something's up.
So if you're experiencing these symptoms, especially after an ear infection, it's time to see a doctor.
Absolutely. Early diagnosis is key here.
Okay.
And, there are also certain risk factors
Yeah.
that can actually make you more susceptible to developing mastoiditis,
Okay.
which are really important for you to know.
The source material points out that children are particularly vulnerable.
Yes.
What makes them more prone to this than adults?
Well, you see their eustachian tubes,
Mhm.
the little passageways connecting the middle ear to the back of the throat.
Right.
They're shorter and more horizontal than ours.
Oh.
That's why it's so crucial for parents to watch for ear infections in kids.
Yeah.
They can escalate into mastoiditis much quicker.
So it's almost like their anatomy makes them more vulnerable to those infections traveling up into the mastoid bone.
Exactly.
That's a good thing for parents to know.
Early treatment is just crucial to prevent complications like mastoiditis.
So children aren't the only ones at risk.
No, they're not.
What about adults? Are there certain factors that make them more susceptible?
Absolutely. A weakened immune system,
Hmm.
diabetes, smoking, and alcohol consumption.
Oh, wow.
All of these can make it harder for your body to fight off infection. That means an ear infection might be more likely to escalate into something like mastoiditis.
Wow. So it really is about taking care of your overall health.
Yeah,
That can really make a difference in preventing these kinds of complications.
definitely.
Okay, so we've covered what mastoiditis is, the symptoms, and who's at risk.
Right.
But how is it actually diagnosed? What should people expect if they go to the doctor?
Well, it usually starts with a physical exam.
Okay.
The doctor's going to examine your ear looking for any redness or swelling.
Mhm.
They'll also gently press on the mastoid bone to check for tenderness.
The source material also mentions imaging tests.
Yes.
What role do those play?
So imaging tests like a CT scan can actually give a detailed look at the mastoid bone and see if there are any signs of infection.
Okay.
It's like taking a 3D picture of the inside of your ear so the doctor can see exactly what's going on.
And blood tests are mentioned too.
Yeah.
What do those reveal?
Blood tests can confirm if there's an active infection in your body and help assess, how severe it is.
Yeah.
They can also give insights into how well your immune system is responding to the infection.
So it's like getting a full picture of the situation from different angles.
Exactly. It's all about gathering information
Right.
to make the most informed decisions about treatment.
Speaking of treatment, what are the typical options for someone diagnosed with mastoiditis?
The first line of defense is usually antibiotics.
Okay.
Depending on how serious the infection is, you might take them orally or, in more severe cases, receive them intravenously.
And I imagine pain relievers and anti-inflammatories might help too.
Of course. Those can help manage the pain and discomfort while the antibiotics do their work.
But the source also mentions surgery as a last resort.
Right.
When would that become necessary?
Surgery is typically considered if the infection doesn't respond to antibiotics.
Okay.
Or if it's particularly severe. It might involve draining the infected fluid or even removing a part of the infected mastoid bone.
That sounds pretty intense.
Yeah.
It really highlights how important it is to get those ear infections checked out early and receive the right treatment.
Couldn't agree more. Early intervention is key to avoiding more invasive procedures down the line.
Okay, we've talked about the conventional treatments,
Mm-hmm.
but the source also mentioned something a little unexpected.
Oh, yeah.
It talks about honey eardrops as a potential treatment.
Yes. This is where things get a little unconventional.
Yeah.
It definitely piqued my interest, too.
According to the source, you warm up some honey, use a dropper to put a few drops in the affected ear, tilt your head, and repeat this a few times a day. Honestly, it sounds a bit too good to be true.
Right.
What are your thoughts?
Well, it's important to remember that this information is coming from the source material,
Sure.
and it shouldn't replace advice from a healthcare professional.
Of course.
Always consult with your doctor for proper diagnosis and treatment.
But I'm still curious.
Yeah.
Is there any scientific basis for this honey remedy?
It's fascinating because honey does have known antibacterial and anti-inflammatory properties.
Right.
It's been used in traditional medicine for centuries for all sorts of ailments.
So there's a chance it could be beneficial?
Potentially. But we need more research to fully understand if it's truly effective for treating mastoiditis specifically.
Right.
It's not something to try on your own without guidance from a healthcare professional.
That makes sense. We don't want to jump to conclusions based on anecdotal evidence.
Right.
But it's definitely something to keep an eye on as research continues.
Yeah.
Maybe one day, honey eardrops will be a recognized treatment option.
You never know. The world of medicine is constantly evolving.
That's true.
Speaking of which, there are some proactive steps you can take to lower your chances of developing mastoiditis in the first place.
Okay.
We've touched on a few already, but let's dive into preventative measures a bit deeper.
Great idea. What can people do to protect themselves?
Well, we know addressing middle ear infections promptly, especially in children, is crucial. Don't let those linger.
Early treatment is key. What else?
Simple hygiene practices like frequent hand washing go a long way in preventing the spread of germs that can cause ear infections.
Good old hand washing. It's a classic for a reason.
Exactly. And if you smoke, quitting is another important step.
I know that can be tough,
Yeah.
but the benefits for overall health are undeniable.
Yeah.
And that includes reducing the risk of ear infections that could lead to something like mastoiditis.
Exactly.
Okay.
And finally, staying up to date on vaccinations, especially the flu vaccine, can help reduce the risk of developing infections that could ultimately lead to mastoiditis.
So it's about taking a proactive approach, boosting your immune system, and minimizing your exposure to those harmful germs.
Absolutely.
But what about the recovery process for someone who has been diagnosed with mastoiditis?
Yeah.
What can they expect?
That's a great question, and it really depends on the severity of the infection and the treatment approach.
Okay.
Someone who caught it early and responded well to antibiotics will likely have a much smoother recovery than someone who needed surgery.
So in those uncomplicated cases, treated with antibiotics, how quickly do symptoms usually improve?
Typically, you'll start to feel better within a few days.
And what about those who do require surgery? What does their recovery look like?
Surgery is a more involved procedure, so the recovery period is generally longer.
Okay.
Patients might stay in the hospital for a few days afterward and will likely need a course of antibiotics to prevent any further infection.
I imagine there's also some pain and discomfort involved in the post-surgical period.
Yes, there can be. Pain medications are usually prescribed to manage that.
Are there any long-term effects? Could mastoiditis cause problems even after it's been treated?
That's an important consideration. While most people recover fully, there are some potential long-term complications that can occur in more severe or untreated cases.
What kind of complications?
In rare cases, the infection can spread to nearby structures like the brain, the inner ear, or the facial nerve.
That sounds serious.
It can be, but it's important to remember these complications are rare. And early detection and treatment greatly reduce the risk.
So once again, early intervention is crucial.
Always.
But let's shift gears for a moment. I'm curious about the historical context of this condition. Do we have any information about how mastoiditis was understood and treated in the past?
Unfortunately, the sources we have for this deep dive don't provide any historical insights into mastoiditis.
That's okay. Looks like we'll have to do some digging on our own.
Right.
But I'm sure it's a fascinating story waiting to be uncovered.
Absolutely. The evolution of medical understanding and treatments is always captivating.
Well, on that note, I think it's time for a quick pause.
Okay.
We'll be right back to continue our exploration of mastoiditis, including a closer look at the recovery process and what you can do to take charge of your ear health.
Sounds good.
Welcome back to our deep dive into mastoiditis.
Yeah.
Before the break, we were talking about the importance of early intervention and how it can really impact the recovery process.
Right. And we were about to kind of delve into what that recovery process actually looks like for those who have been diagnosed with mastoiditis.
Exactly. So let's talk about that.
Yeah.
What can someone expect as they recover from this condition?
Well, the recovery journey can vary quite a bit,
Okay.
depending on, the severity of the infection and what kind of treatment was needed.
Right.
Someone who caught it early and responded well to antibiotics might be back to normal pretty quickly.
Okay.
But for someone who needed surgery,
Yeah.
the recovery is going to take longer and be a bit more involved.
Okay, that makes sense. So let's say someone had a mild case
Yeah.
and was treated with antibiotics.
Right.
What would their recovery timeline typically look like?
In those straightforward cases, you'd usually start to see symptoms improving within a few days of starting the antibiotics.
Okay.
But it's still important to finish the entire course of antibiotics as prescribed,
Right.
even if you start feeling better before you've finished all the medication.
Right. I've heard that before.
Yeah.
It's so tempting to just stop taking them once you feel better.
I know.
But you have to finish the course to make sure the infection is completely gone.
Exactly. You don't want to give those bacteria a chance to kind of bounce back.
So what about the folks who do end up needing surgery?
Right.
What can they expect during their recovery?
Well, as you can imagine, surgery is a more involved procedure.
Right.
You might need to stay in the hospital for a few days afterward.
Okay.
And you'll likely be on antibiotics to prevent any further infection.
I bet there's also a fair amount of pain and discomfort after surgery.
There can be, but your doctor will prescribe pain medications to help you manage that.
You mentioned earlier that there are some potential long-term complications
Yes.
that can occur with mastoiditis.
Right.
Can you elaborate on those a bit more?
Sure. While most people recover fully from mastoiditis, especially when it's caught and treated early,
Right.
there are some risks associated with more severe or untreated cases. In rare instances, the infection can actually spread to nearby structures,
Yeah.
like the brain in your ear or facial nerve.
That's a bit unsettling to hear.
I understand. But it's important to emphasize that those complications are rare.
Okay.
And seeking medical attention at the first sign of trouble drastically reduces the chances of something like that happening.
So once again, early detection and treatment are key.
Absolutely. It's always better to err on the side of caution when it comes to your health.
Speaking of caution, are there certain activities that people should avoid while they're recovering from mastoiditis?
That's a good question. It really depends on the individual case and the severity of the infection.
Sure.
Your doctor will give you specific instructions,
Right.
but in general, it's wise to avoid strenuous activities initially.
Right.
Things like swimming might be off limits until your ear has fully healed.
So it's all about listening to your body and following your doctor's guidance.
Exactly. Don't rush the healing process.
We've talked about the physical aspects of recovery, but I'm also curious about the psychological impact. Yeah, I imagine going through something like this can be pretty stressful.
You're right. Dealing with a serious infection, especially one that involves surgery or potential complications, can be anxiety-provoking.
Right.
It's completely understandable to feel stressed or overwhelmed during the recovery process.
That makes sense. Are there any resources or support groups for people dealing with the emotional side of mastoiditis?
The sources we're looking at today don't list specific support groups,
Okay.
but your doctor is a great starting point.
Right.
They can offer guidance and potentially connect you with relevant resources in your area.
That's a good reminder that doctors are there for more than just physical health. They can be valuable resources for emotional support as well.
Absolutely. And don't underestimate the power of connecting with others who've been through similar experiences.
Right.
You might find comfort and support in online communities or forums where people share their stories about mastoiditis.
That's a great point. It's always reassuring to know you're not alone in your journey.
Exactly. And remember, there is always hope.
Yeah.
Most people make a full recovery from mastoiditis.
Mm-hmm.
And with the right care and support, you can too.
That's a great message to end this part of our discussion on. Before we wrap up our deep dive into mastoiditis, I want to circle back to something we mentioned earlier,
Okay.
the potential of those honey eardrops as an alternative treatment.
Right.
While we always emphasize the importance of consulting with a healthcare professional,
Of course.
I'm still intrigued by the idea of natural remedies and their role in healthcare.
Yeah.
What are your thoughts on this?
It's fascinating to think about how people have used, natural substances for healing,
Yeah.
like throughout history.
Right.
Honey, with its antibacterial and anti-inflammatory properties, has definitely been a popular choice.
It really makes you wonder what other, everyday items might have surprising medicinal benefits
Right.
that we haven't fully explored yet.
Right? Like what's hiding in our kitchens or pantries
Yeah.
that could potentially help us feel better.
It's like a whole world of natural remedies just waiting to be discovered.
Yeah, that's the beauty of science and exploration. There's always more to learn and uncover,
Right.
both in the natural world and in the lab.
This deep dive has definitely sparked my curiosity.
Oh, good.
I'm going to be looking at the contents of my spice rack a little differently from now on.
That's great.
So to our listeners, we challenge you to do a little digging of your own.
Yeah.
What everyday items in your home might have hidden healing powers.
Right.
Do some research. Maybe even try some safe home remedies.
Yeah.
Always with caution and professional guidance, of course.
Of course.
Let us know what you discover.
We might even feature your findings in a future episode.
Oh, that's a great idea.
We love hearing from our listeners.
Well, that brings us to the end of our deep dive on mastoiditis.
Yeah.
We've covered a lot of ground today.
We have.
From the causes and symptoms all the way to treatment and prevention.
And even honey.
And even honey.
Yeah.
Thanks to everyone for listening, and we'll see you next time.
See ya.